You don't want to miss this, especially if you're over 60 or have elderly loved ones. There are 5 warning signs of stroke that can strike without warning, and if you don't recognize them in time, the consequences can be devastating. We're talking lifelong disability, or even death. In this video, I'll walk you through the life-saving signs everyone needs to remember so you can act within the very first minute. Because when it comes to stroke, time is brain, and every second truly matters. Sign number 1. Sudden loss of balance, when the body can no longer stay in control. Imagine your elderly loved one is walking around as usual, then suddenly becomes unsteady, needs to grab a wall, or has to sit down due to intense dizziness, like the whole room is spinning. Even if it lasts just a few minutes, this kind of sudden imbalance should never be ignored. Why is this so concerning? Because unlike lightheadedness from standing up too fast or being tired, this type of dizziness, paired with loss of balance, can be a clear indicator of a stroke in the cerebellum or brainstem, the parts of the brain responsible for movement and coordination. If you ever notice someone suddenly stumbling, unable to walk straight, or needing support just to stay upright, don't wait. Call emergency services immediately. Acting quickly could prevent serious complications like paralysis, or even save their life. Sign number 2, sudden vision problems, when the eyes. Sound the alarm, blurry vision, double vision, or suddenly losing vision in one eye. These are all serious warning signs of stroke. Unfortunately, many people brush them off, thinking it's just eye strain or a normal part of aging. But here's the truth. Any sudden change in vision, especially in people with heart or vascular risk factors, could signal an acute brain event. It means blood flow to the part of the brain controlling vision has been interrupted, and symptoms appear instantly. If your loved one is reading and suddenly says the words look fuzzy or they can't see out of one eye, treat it like a red flag. Don't wait for the symptom to go away on its own, because the longer you delay, the lower the chance of a full recovery. Sign number 3, uneven facial expression, when a smile isn't symmetrical. One of the easiest to spot signs of a stroke is a sudden change in the face. If someone's face suddenly droops on one side, their smile becomes uneven, or they complain of numbness. Take it seriously. A drooping face isn't just a cosmetic issue, it's an emergency signal from the brain. Why is this dangerous? Because during a stroke, the part of the brain that controls facial muscles can be affected, causing partial or full facial paralysis, sometimes permanently. Want a quick test? Ask the person to smile or raise their eyebrows. If one side doesn't move properly or their mouth droops, that's a clear stroke sign. Sometimes you might notice saliva dripping from one side without them realizing it, another red flag that needs urgent attention. Have you ever thought a small change in someone's face could warn of a major stroke? Never underestimate subtle but sudden signs. That could be the brain's cry for help, and you might be the one who makes the life-saving call. Sign number 4, sudden weakness in the arm or leg, when the brain loses connection with the body. One of the most dangerous, yet often overlooked, signs of a stroke is sudden weakness or numbness in an arm or leg, especially when it affects only one side of the body. Picture this. You're chatting with an elderly loved one, and out of nowhere, they can't lift one arm, or they start stumbling because one leg suddenly feels too weak to stand on. Don't brush it off. This could be a critical warning from the brain. Why does this happen? During a stroke, blood flow is cut off to a specific part of the brain that controls movement. It's like a power outage. The brain region goes offline and can no longer send signals to move the muscles. The result? The arm goes limp, the leg gives out, and it often comes with no warning at all. What you need to remember is this. This is not regular muscle fatigue. It's sudden, clear, and asymmetrical, usually on just one side. Here's a quick test. Ask the person to raise both arms overhead at the same time. If one arm drops or they can't keep it up, call 911 immediately. Many people dismiss sudden limb weakness as something minor or just tiredness. But if it happens fast and without a clear cause, it could be a sign of ischemic stroke caused by a clot, or hemorrhagic stroke caused by bleeding in the brain. And with every passing minute, millions of brain cells may be dying. Don't delay. Act fast. In the next section, we'll uncover the fifth warning sign, often subtle but incredibly dangerous if missed. But before we move on, there's something crucial you need to understand. Recognizing the sign is only step one. Protecting the brain takes more spotting. The early signs of stroke, like when a loved one suddenly drops a coffee mug without knowing why, can be life-saving. But stopping there isn't enough. If we truly want to protect the brain and the circulatory system, we need to dig deeper, to understand the underlying causes and take steps to prevent stroke from ever happening in the first place. What many people don't realize is that brain blood vessel health depends heavily on everyday habits. What you eat, how well you sleep, whether you check your blood pressure regularly. And of all the risk factors, high blood pressure is one of the most dangerous and one of the most silent. Imagine the blood vessels in your brain as delicate water pipes. Now imagine increasing the water pressure inside those pipes every day. Over time, the pressure wears them down, makes them fragile, prone to rupture, or clogs them with plaque buildup. What makes this so scary? High blood pressure often has no obvious symptoms, especially in older adults. That creates a dangerous loop. No symptoms, no checkup, no diagnosis, no treatment. And by the time a stroke hits, it might already be too late. So ask yourself, are you caught in that silent loop right now? In the next part, we'll look at the fifth warning sign and how to break this dangerous cycle before your brain pays the price. Sign number 5, sudden difficulty. Speaking when the brain loses its voice. Imagine you're having a normal conversation with a loved one. Everything seems fine until suddenly their voice changes. They start slurring words, stammering, speaking in broken sentences. Or worse, they fall completely silent, eyes still alert but unable to say a single word. This is not forgetfulness or fatigue. This is a loud, urgent alarm from the brain, and it's one of the clearest signs of an acute stroke. During a stroke, the areas of the brain that control speech and language may be deprived of blood. This can result in saying the wrong words, not understanding what others are saying, or being mentally aware, but completely unable to speak. Tragically, many people miss this sign. They think it'll pass. They wait, hoping for improvement, and they lose the golden hour, that short window where medical treatment can save brain cells and restore speech. Here's what to do. If you notice someone speaking strangely, ask them to repeat a simple sentence, like, "The sun is shining today." If they can't say it clearly, stumble over it, or don't seem to understand, call 911 immediately. Every minute counts. Every minute, millions of neurons may die. Whether someone regains their voice, their ability to connect with the world, or suffers long-term disability, may depend on how fast you act. Knowing how to fight the fire is good, but preventing it is wiser. Too often, people only start caring about their brain health after a stroke or after memory loss creeps in. But the truth is, everyday habits, not big medical events, are what protect or damage your brain over time. Let's talk about 3 habits that silently sabotage your brain's ability to speak, think, and thrive. 1. Brain-damaging diets. Every deep-fried donut, every sugar-loaded soda, they do more than pack on pounds. They increase bad cholesterol, promote arterial plaque, and choke off blood flow to your brain. And when your speech centers don't get the oxygen and nutrients they need, you're inching closer to a stroke, or worse, losing your ability to express yourself. 2. Sitting all day, starving the brain. Lack of movement slows circulation, and when blood doesn't flow well, your brain doesn't get enough oxygen or fuel to function properly. We often think of exercise as something for muscles, but your brain needs it too. Every step you take helps feed your brain. 3. Chronic stress, the silent saboteur. Modern life is stressful, no doubt about it, but long-term stress triggers hormones that raise blood pressure, cause inflammation, and damage blood vessels. Over the years, unchecked stress can shrink your brain's ability to think clearly, communicate effectively, and regulate emotion. Don't wait for a stroke to take care of your brain. What you eat, how often you move, how you manage emotions. These aren't just lifestyle choices. They're daily votes for or against your future brain health. Your ability to speak, think, and live with clarity depends on these small, consistent decisions. Prevention is always cheaper and far more effective than treatment. If you suspect someone is having a stroke, call 911 immediately. This is the most important action you can take to save their life. Why call 911 instead of driving them yourself? Because every minute counts. With each passing minute, millions of brain cells may die and never recover. Emergency medical teams can provide life-saving care on the spot, transport the patient to a stroke-ready hospital with specialized staff, alert the hospital in advance to prepare critical interventions. Driving them yourself wastes precious time and could put both of you at risk if their condition worsens en route. Don't forget, note the time symptoms begin. This information is crucial for doctors to determine the best treatment, especially if clot-busting medication might be needed. What about a mini-stroke, or TIA? A transient ischemic attack, TIA, may seem to resolve on its own, but it's not harmless. It's a warning. A major stroke could happen within hours or days, so treat a TIA as a medical emergency. Never wait it out. While you wait for emergency services, here's what to do. Stay calm and reassure the person. Have them lie down with their head and shoulders slightly elevated. If they're vomiting or have trouble swallowing, gently turn them on their side to prevent choking. Do not give food, water, or medication, including aspirin, unless directed by medical personnel. Write down their symptoms, any changes, and the exact time they started. Clear the path for paramedics, unlock doors, and gather any medications or a list of what they're currently taking. Timely action can save a life and determine the quality of life after a stroke. Don't hesitate, don't delay. Stay informed, and don't miss our next videos, where we'll dive deeper into early warning signs and the most effective ways to prevent strokes.